it's 11 o'clock and we have a boatload that we're trying to cover in this meeting. So I've asked everybody if you could put your name and affiliation in the chat box. And for the moment today, we're going to sort of skip by doing introductions and go straight into some information and a presentation from Randy Hayden, who is the CDMH, which stands for Chemical Dependency Mental Health funding. It's a 0.1% funding in Snohomish County. So Randy is the board chair of the advisory board for that fund. And in our effort to understand more about what funding is available around Snohomish County, specific to Snohomish County, and how we might get rural perspective to the funding tables, the tables where the strategies are being made about what to do with that funding, and the ways to interact once those plans get made and funded, how to help them be implemented effectively with our rural areas. So I'm going to have Randy go ahead and start with his overview of what CDMH is, and I'm sure that we'll have questions. There's a lot of information in this packet, so don't worry, we don't have to cover it all today, but we're going to at least give you the skim over. Welcome everybody else. Just quickly before Randy starts, I'm putting the links to the meeting packet and the meeting Padlet in the chat. And thank you all for putting your name and affiliation in the chat box. Okay, Randy, I'm handing it over to you.
Okay, well, thank you, Lori. First, I'll start off by a quick little synopsis on how I got to where I'm at. In 2012, I applied to be on the Alcohol and Other Drugs Advisory Board. After 3 years, I was voted on to chair of that board, and being chair placed me on the Mental Health Chemical Dependency Board. So I've been on this board since 2015. I think there's only one other person on the board that has been there as long as me. So it's you know, I've been on there 9 years and I'm still learning a lot every meeting. There's a lot going on there as far as the 1% of 1%. We roughly have it's probably about a $28 million budget that we advise our county council people and our county executive, Dave Summers, on how we would like to see the money spent. As you'll see in this slide that Lori has up, we've kind of defined our focus areas, you know, prevention, wellness, crisis, engagement, outreach, and every year we reassess what should be our priorities as we're making advice to the council on how the money is spent. So you'll see in these bubbles, and a lot of these bubbles overlap, you know, such as crisis and treatment. We have crisis centers that give treatment also. So it's kind of tricky sometimes to figure out exactly, you know, where the money is going in full with all the overlaps going on. So the makeup of the board has changed quite a bit over the years. Currently we have, as you'll see with this slide, currently we have 13 positions, but we're proposing to bump that up to 15 positions on this board. Things don't move really fast on making changes. Because when I was appointed to the board in 2015 as chair of the AOD board, 2 years later, or 1 year later, the AOD board was canceled because under the Affordable Health Care Act, mental health and chemical dependency were put under one umbrella, which basically disbanded the board I was on, which then basically didn't give me a seat on the board. So I was on the board for roughly 6 years without a real position on the board. They finally changed and gave me an at-large position for quite a few years. I was the guy who officially was there but wasn't there, and I kept telling them, well, maybe I should step down, and no, they insisted. They wanted me to stay. So as you can see how this is split up, the board seats, we try to cover all aspects of the needs that we have with the at-large, the court and jail, service providers, and the other boards. But it seems like since COVID hit, the involvement on this has really slowed down. Before COVID, we would have in-person meetings and usually had 35 to 50 people at our meetings. And once COVID hit, the door kind of shut. We went to Zoom meetings, but the people slowed down. I think currently we're averaging about 25 people that attend the meetings outside of our board members, but we've actually lost some board members due to their terms expiring too. So currently we do have 3 board positions that we really feel the urgency to get these filled. And with talking with Lori, I kind of opened my eyes. I didn't realize that, we really don't have any rural involved in this other than myself. But as we've been having these discussions, it's becoming very evident that rural representation on this board needs to happen. So I think part of the reason Lori has me on here is for this group to think about some of these positions and where we can pull from the rural community to fill these positions. So let's see, next slide. I got to get caught up here. You'll have to forgive me. I'm working out of my car. So
we're just grateful you made it today.
Yeah. Okay. So yeah, this slide here goes back to these bubbles, our priorities. And I think at our next board meeting, so our board meetings are every other month. They're the even months of the year, and they're the 3rd Wednesday. So I am going to make some recommendations of possibly getting through this chart that you have up. It broke down to maybe a pie chart of roughly where the dollars are going to each of these bubbles that we've been focused on. But like I said, some of them overlap. And through the years that I've been on there, I've seen some really great spending going on as far as where it's going, but it's with a budget that big, it is kind of hard to track all the dollars. So, and I will say, going back, let's see, where are we at? Which slide you got there, Lori?
I'm on the clarify CDMH process. Am I ahead of you?
I'm not sure.
So we talked about the bubble chart, and I will say to folks,
okay,
these hexagons that you see, CDMH has a chart that shows them in a circle, some bubbles. And because we are going to be looking at not just CDMH, but the North Sound Behavioral Health Administrative Services Organization, the Opioid Settlement Fund that's administered by the Department of Emergency Management, I wanted to create something that we can just keep adding hexagons to, so that we, maybe in a different color, so that we understand the different types of focuses that these various organizations have. But as a rural community, we're trying to understand where can we go for what type of funding, or where might be the best place to start to look at where we might go.
Yeah.
Okay. So Randy, now I'm turning it back to you, and I'm at the sort of the bits of work we know we have yet to do.
So I'm not finding that chart, their action item.
Oh, does it look different than the timeline slide? Basically, what this slide
Yeah.
is it talks about sort of what we don't understand yet. And it doesn't mean that it isn't clear somewhere. We just haven't put that understanding into our own awareness. But I think it's
Yeah.
really valuable for this group to understand.
Mm-hmm.
Um,
And I will say that with the talks we've had over the last couple of days, Lori, it's really opened my eyes to questions I need to ask on information. For us to have this information so we can figure out exactly where the needs are. I said it seemed like over the last 3 years that with the COVID and how our meetings had kind of in fact, a lot of the meetings were actually canceled during COVID. So we're not getting the full information that we were 4 years back. And it kind of every year was a little less, and we kind of got into this complacency that we're just going to get the information that they're giving us, but not questioning the information. So
and we all know how with organizations, I mean, I can speak from experience that through COVID, our bandwidth was taken up in so many ways, shapes, and forms. There just wasn't the bandwidth to do some of this work. But now is a great opportunity to sort of circle back and start to tighten up some of those transparency opportunities.
Yeah, and I agree 100% there. So this slide here kind of shows finance aspects. Now, before because we had a different financial director, and he was very thorough. This new financial director is new, and I'm not faulting him in any means, I think, but we need to give him a little more guidance on the numbers we need, because before, following the dollars was a very big part of this board, and we would look, it was broken down a little better as far as the spending, what was allotted, what was spent. A lot of these are moving numbers, like with the court system. You can allot so much, but sometimes only 2/3 was spent, or sometimes more, because it depends on the courts and how many people are coming through the courts as far as spending. So there's a lot of moving parts in our budget that aren't set, which when I first got onto this board, they were carrying over almost 20% of the budget. And for quite a few years, our focus was to have less carryover, because it just seemed kind of foolish to have all this money sitting in a bank when it can be used for programs that were needed. So we've slowly whittled things down to about, I think for next year, we're down to about a 5% carryover, which to me seems a lot more reasonable. Okay.
The slide that we're on is the one that just gives a more detailed breakdown of the various categories, or within, for instance, the Human Services Department, the realm of what that means when you see that one line on a budget sheet.
Yeah, and as you look at this sheet, you'll see that, there's what the council approves and what the executive recommends. So typically what happens, the executive will put together his budget as a recommendation to the council, and then the council will look at our recommendations and try to work all these recommendations into what they think is the best budget for the county. So you'll see there's a lot of changes there. And I don't know if you have the one chart that has the 5-year projected outlook, but I've gone through, I went through our 5-year projected outlook in 2015 and compared it to the 5-year outlook in 2017, where they overlap. And you can see there's a lot of differences in projected budgets, down the road year to year. And I'm glad to say that are that they've been under addressing the projected budget that they would come in, which is good because that allows us to at the 2/3 of the way through the year, then we've got this extra money that we can send out. And we've never once had a shortfall in our budget where we then would have to say, okay, everyone, we're making a 5% cut across the board. Figure out where you're going to do your cuts. So that's the worst thing I think we could ever do is tell these needed programs that it's time to make cuts because we just don't have the money.
You'll notice that you can click in on any of these. They look a little crooked because that's what the pages look like. But if you click in, you can look at them at much bigger font, so you can see some comparisons there. And then I know we're at 11:16, so I'm moving us quickly through the other items there. We talked about the idea that we'd like to see how much was invested, for instance, in 2023 across those areas that we saw are the investment focal points. And I'm going to stop there for a moment. Are there questions? Are there questions for Randy before he has to? Bless him, he is here and has to go to a meeting shortly, and which is why he's running it from his car. But are there questions that you would like to ask of him, or that you think we should be thinking about as we look at the potential of understanding more about the chemical dependency mental health funding opportunities? Don't everybody talk at once.
Well, I would say for this group, the important part of this is let's look to getting these places filled on the Mental Health Chemical Dependency Board with people that represent rural community, because that is something that we're very much lacking. And even though I'm from rural community, that wasn't why I was put on. And I tell you what, it was a big eye opener talking with Lori and realizing, this big void we have on our board.
We'll circle back. You'll notice on slide 5 in your packet, we show what they're proposing will be the different members and the vacant spots that are in the different areas on those boards. I'm hoping that layer by layer, I'm making the case that there should be somebody from this table who either is a service provider, possibly an at-large member, who could be on that board. And it isn't that you would be on that board and alone. The whole idea of this table is that we would support you in helping to get the rural perspective that we want to have represented at that table. One of the things that you would be able to do is make sure that that gets carried forward to the folks who are sitting there and making decisions about this funding that comes in. Thank you so much, Randy, for all the work that we did just getting to this point, being able to present something, and for making it fit in your day. Any last thoughts? Do we know when the next CDMH meeting is? Whoops, wait, you're on mute. Sorry.
No, we don't. I checked my email this morning because we are having a special meeting on the budget. So, and this is something I didn't discuss, is Snohomish County is going to a 2-year budget. We've always gone with a 1-year budget, and normally they start the budget process usually in June. But now that we're going to this 2-year budget, they're starting it early. So we will be having an early meeting. Our next regular scheduled meeting isn't till June, the 3rd Wednesday of June, whatever, I forget what date that falls on. But yeah, with this 2-year budget, it's going to be a completely different animal, and it's going to be interesting to see how they run this budget out. And I unfortunately, I don't think they thought this process out fully, because I think they should have gone with one more 1-year budget and then started the 2-year budget next year, because it's not good to finalize a budget the month before a presidential election, because all our funds, are revolve around how people are going to spend money. So just my 2 cents there, because it could be business as usual, or we could go into turmoil. It's hard to say. So
Well, thank you so much, Randy. I will find out the date and let folks know what that is. I attend, or at least will for the next couple of months, will attend those meetings, and between Randy and I can give updates on that. Okay.
okay, thank you.
Thank you so much. All right, moving on in our packets, I wanted to quickly show you one of the things that came out this past week was the announcement about Kroger and the, that number is wrong. I think it should be closer to 50 million in the packet that you see. Kroger, sorry about that. Hate when you see a mistake in the middle of a presentation. I think it's 47.5 million that came in as a result of Ferguson and the lawsuit around getting settlements around combating the fentanyl crisis. In that article, which there's a link to there on this slide, there was also a link to a spreadsheet which you have, and if you click that link, it goes right into, it will download the Excel spreadsheet, and it shows for all of Washington State, at least as of April 22nd, what the allocations are for opioid settlement funds across the whole state. And they do it by county, and within county, they show how much each town is getting. And don't quote me on this, but I think I understand that a city is considered 10,000 and above, 10,000 population. And so those cities that you see noted on this slide are who meets that criteria here in Snohomish County, and the amount that they're getting. So what that says to me is that there are likely, and I should also clarify that this happens over a period of years. Sometimes it's 12 years, sometimes it's 15, sometimes it's 17. It seems to depend. So they're not, Bothell is not going to get that million and 1.3 all at one time. It's going to be spread out over years. But it does tell me that there are likely tables going on around the county that are planning and trying to understand what is most needed in their area. And ideally, because there is no one table for the rural places that are under 10,000 in their population demographic, we would know which tables are close to where we are, or also be at the county table, making sure that the rural perspective is articulated and clarified and worked into whatever the planning and ultimate implementation is for the various things that get done with all of this funding that's coming in. So again, opioid settlement funds, a separate tranche of funding from the chemical dependency mental health fund, two different things, but both aimed, one at the opioid crisis and one at and one more broadly across mental health and chemical dependency. And David, I see your hand up.
Yeah, no, I really appreciate you mentioning that this is spread out over a number of years, and it really depends on the settlement. It's not like the county or any of these cities have gotten these monies all in one go. And you're absolutely right, it is above 10,000, and there's also a burden of opioid deaths that needed to be met for that as well, but all of the cities over 10,000 met that. The other thing that I was thinking about when you put that up is that also does not include the fees that are taken out for the lawyers who argued the cases and got to the settlement. So that is the amount given to the at least for the county. I know that some of that is actually going back to paying legal fees. So there is some amount that's taken off doesn't represent the true amount, and it isn't a whole lot of money, but it does take away from some of our ability to do that. And here comes Jan Rose to completely negate everything I just said, I'm sure.
Jen Rose, thank you for being here. You as well, David.
And oh, sorry, I turned on my camera and realized my little slidey thing was closed. Everything, David, you said was actually absolutely correct. So I'm not coming on here to null and void it. The one thing I would say is what that doesn't, those spreadsheets don't identify either, is when payments are delayed. So one thing we've already experienced, and we're in the first year of these payments coming out to counties and participating governments, is that already payments are delayed. And so while counties and cities are trying to identify how to spend these funds, they're also somewhat waylaid by not entirely being certain that they'll get the funds when they're supposed to. So that's added definitely another layer of complexity, in addition to the bankruptcies some of those corporations are now claiming as well, that is adding on to it. And just for everyone's context, I am Jan Rose Ottaway Martin. I'm the Executive Director of North Sound Behavioral Health Administrative Services Organization. It is a mouthful, but we manage the behavioral health crisis continuum in a 5-county region, including Snohomish. So thank you, Lori, for having me here.
Thank you so much. And next, at our next meeting, Jen Rose is going to give us an overview of that agency. So we'll look forward to having her here. And I appreciate you giving setting some expectation around how quick or how easily those, even our understanding of when those funds will be here. It seems to be in a delayed manner on some fronts. Of course, over here in Jefferson County, we had somebody randomly pay, not somebody, but some organization randomly pay in advance. Like, I guess every 5 years you can pay a certain payment in advance. So who knows? Let me share my screen once more. I wanted to show quickly, I appreciate so much that Juliet was able to work with GIS over at the county, and they got us a Snohomish County population density map, which if you have to click on the link to go into the interactive one, but if you click on that link, you can hover over the various places and see what their population is there. And you also see that there are a lot of places that are just open, but they're still in Snohomish County. So I'm just trying to give you a sense of where the range of actual space or geography that is not in one of these specific areas, that we still have an opportunity to connect services and people. And maybe we can do it better, more efficiently, improve how we're doing it going forward with the various realms of funding that are coming in. Okay, are there any questions there before I launch into really quick talking about what rural stakeholder engagement would look like? They say to wait 23 seconds. Okay, that feels like a really long time. All right, moving on. So rural stakeholder engagement, when we talk about having someone from this table go be, for instance, at the CDMH board as a representative, it isn't just to go sit on the board and listen, and it isn't just that person. I'm talking about the whole group of people that are at this table, or the group that we hope to recruit to this table. We would want to send that representative in armed with insight around assessment of what our needs are. And that's something that we could be very directed about doing at this table, that assessment. And it's not that we would have to do it ourselves, as much as I think that there are various pockets of information that are in silo that we could bring together in some coherent manner and make sure that our stakeholder representative could take it to whatever table we're sending them to. We could provide input to the incorporation of those insights about what is needed and what works well and what is a priority here in the rural areas at whatever strategic planning table has been awarded money or is looking to create a project in which to go seek funding for. And then lastly, to help with the implementation of whatever those plans are, so that what is being done makes sense and is done as efficiently as it can be in our rural areas. So these slides have a lot of text on them, just in case you thought, well, I don't really know what that means. I've tried to give ideas of what that could look like for giving rural insight to establishing the priorities, what it would look like if we had a representative sitting at a table and how we would support that representative, and how we would get to the implementation table and what we would expect we might be able to do that's supportive there. So it's not just that we're going out and we're looking for funding, we're trying to communicate in a way that everybody understands why that funding is needed and to collaborate with their insight and knowledge combined with ours to create something that allows us to bridge the gap between the urban and the rural areas. Any questions there? Because I'm about to ask people to turn on their cameras because now we're going to have a discussion about our community conversations. Hey, Joe. Thank you. Let's see. I know some of you folks are likely working out of cars. Anybody who can, please turn on your camera so that we can actually talk about these community conversations. Now, you remember from our last meeting, we're bringing in Tedra Cobb, who is one of our, she's a facilitator who I met through our HRSA funding. They had a reverse site visit to Washington, D.C. She does an incredible job facilitating conversations in rural communities around mental health and substance use stigma. And they're low stakes conversations. She has some videos of some gentle conversations that she has with people who are in the midst of whatever life circumstance, whether it's recovery or it's a mental health challenge. And there's artwork that has been done that some of these people do. And she lets whoever is there listen to the short interview. And then the conversation that she starts us with is, if you could ask that person any question, what would you ask them? And I'll tell you, I watched it unfold while we were in Washington, D.C. She did one of these there, and it was incredible. It was gentle and it was heartwarming and it was a good conversation. And this isn't to change people's minds or, call people out. This is very much just a conversation. So we're doing that in Darrington and in Monroe, our two federally designated rural areas. I take that back. Monroe is not designated as a rural area, but we're going to transport people in from as far out as we can get out to index in as many people as we can gather. So we're going to do 2 sessions, and then on the last day, we're going to have she's going to do a train the trainer event, and we're going to hold that at the Department of Emergency Management in Everett. And our goal is to get as many community leaders, as many people as our community leaders know would be good in this role of facilitating community conversations around stigma. Bring them in, get them trained, and ideally, we're not going to say, no, you can't come, but if you're coming to the train the trainer, you will have gone to one of these community sessions, either in Darrington or Monroe, and seen what it looks like, what it feels like, what the kind of questions are that you get, how the whole thing runs before you then get trained on how to do this. Our goal is that we bring in Tedra as the ringer on helping our communities have these conversations, train up enough of us that we can continue that work going forward after she goes away. So it's not just a one-time, we spent money and now we can't take it further. And maybe we only get community leaders to this first one, but I think it's the beginning of something that really has a great opportunity for helping us understand and collaborate better with each other. Stigma is, I would, in the work that I do, at least, sometimes I feel like it's one of the biggest obstacles. You can say it's money or whatever it is, but I feel like stigma is really the first place, and I have it's at all levels of the realm of places that this conversation could happen. So Darrington conversation happens on Wednesday, the 26th. We're saying 3 to 6. We might set up a little earlier than that. I think it's about a 2.5 hour process that we go through. I've given you just a little overview of the content that I think would end up on a poster that we'd be creating. And oh, by the way, Juliet, can we use the county's communications team to help with any of this, creating of posters and that sort of thing? Yes, she's
Sorry, I
nodding.
couldn't find my mute button there. Yeah, we have a really wonderful comms team in the health department, and I will ask them for some support on this. Yes.
Okay, great. So know that we're gonna have something professional looking in terms of social media and posters and that sort of thing. I have brainstormed with a couple of you. I brainstormed with April as well as one other person who we sat down and brainstormed a few ideas of how to raise the profile of this. One of them was to go to city council meetings and just make public comment saying that it's happening. So this is the event in Monroe. It will happen Thursday morning. So one in the late afternoon up in Darrington, then we're going to whip her down the next morning to Monroe, do one there from 10 to 1 p.m. And that is going to be held at the Monroe Community Resource Center. Donnell is wonderful. She's the person who runs that center, and I think it's going to be a great location for it. I would also say big shout out to Mari and the DPICC, maybe 2 or 3 C's after that. They are going to pony up for some funding to do some food or snacks or refreshments or something. So I think that will help bring people in if we can stay on the poster that there's going to be food. And then our Train the Trainer event happens that same day, Thursday, from 2:30 to 5:30 at the Department of Emergency Management. And of course, everyone is welcome. Our goal there is to develop this Snohomish County focused community conversation facilitator troop of people that we can go out and do this across our county. And while this grant is focused on rural, I want to underscore that anybody can come to any of these events. And when TEDRA has gone back, we can do this in an urban or a rural area. I think having the skill set under our belt is going to serve us well throughout this county, no matter if you're rural or urban. So now, what I would like to do is think a little bit about how we make sure that this is a success. There is, I'd love to go around quickly and just think about any rapid fire idea you have about how to engage and promote this event through either your own network or social media. And I am going to put Juliet on the spot first. She's so close.
Still not doing well with the mute button today. Great question. We have social media channels that I would love us to share this through, both through Snohomish Overdose Prevention and the health department. So I think those would be really the easy places to start.
Okay, great. Joe, any thoughts?
Sure. You probably know, Lori, that Darrington through DPIC, Monroe through the Monroe Community Coalition, and Sultan through the Sultan Prevention Coalition all have people who are already taking leadership roles and advocacy roles around these issues. So communicating with the coalitions so they can invite people on their distribution list would be a good idea. The other question I have wondering about, since we're really trying to support underserved populations, will the promotional materials be multilingual? Will we have a translator on site? Will we have food on site? I mean, I learned a long time ago what brings our Hispanic and Latino population is when we can include friends, food, and fun. And so, how do we promote it in their language as it goes? And then the other thing too is, because I'm really focused on serving our Hispanic and Latino population here from an access perspective, beyond stigma, there's even an issue around whether or not mental health exists. And so the communication, the outreach in Monroe, might even acknowledge that. Does mental health exist, and what's going on? And then last thing I'll say, sorry I'm giving you so many words, is I'm like 10 days away from having a final draft of a Spanish language mental health access tool, a 10-minute short documentary where Spanish speaking men are talking about the existence of mental health and what needs to happen to get through those barriers. So happy to share that with you.
Oh, that's
It's
exciting.
almost ready. It's a year-long project.
That is exciting. Yes, I would absolutely like to be connected with it. Know that I like all of the words that you put out there.
Okay.
Juliet, I'm betting we can make sure that we have multilingual. Yeah, I think that that's something that definitely the health department, and you saying that thing about, do we even believe that mental health exists? It makes me wonder if maybe we just say stigma, we don't call out mental health, maybe we say substance use.
Sure.
Something
And
to think
you know,
about.
one of the things we've learned from all of our focus group work is, the appropriate language to engage this population in East Snohomish County is talking about mental strength, developing our mental strength. That's not perceived as weakness. And
Right?
then what we've also learned is that talking about substance abuse is a good bridge into, does mental health exist? And
Okay.
so while the community may be less open to discussing mental health and mental strength, they do acknowledge that substance abuse exists, and it's a good inroad into talking about mental health.
All
So I'll take
right.
a step back.
It is good words, wise words. Thanks for that thought of how we might frame even our language on the poster, because we want to bring people in, not sort of push them off. Jen Rose, any thoughts?
Yeah, on our side, if we have the information in a shareable form, we have the entire provider network. So all the behavioral health agencies that serve the 5-county region, many of them overlap across counties, and many clinicians and individuals who work for those entities actually might not live in the same county that they're working, right? So we can get that out to that entire listserv pretty quickly. We also have an advisory board, and those advisory board members, also side note, we always have openings on our advisory board. I'll speak about that next month. We have a advisory board, and those members are very involved in their communities and attend multiple other meetings, including NAMI. We can spread information through those avenues as well. So we would just need a shareable, some kind of poster or some kind of entity, and we can get it out to our networks pretty quickly.
Okay.
We do not have a social media presence, but we'll be working on it in the future. So more to come on that front.
Okay. Well, we can send you both a poster and a social media. So if whoever you're sending it to has one or the other or both, they'll be able to use it. I'm saying that, Juliet, very confidently that we're going to quickly create something and get it out there. Rachel, thank you, Jen Rose. Rachel. Do you know what I can't remember when you joined. You know what we're talking about?
Yes, I'm
Okay.
assuming we're talking about the slide that is
Yes.
up.
And we're doing rapid fire ideas around how to engage and promote, and around the powerful messages. If there's a message that you think, like Joe gave, a good sort of step into the messaging.
Yeah, I mean, I feel like having the idea of utilizing the communications team that we already have and that we already work with is really important. We've been trying to incorporate like utilizing them in MAC group efforts as well. And so I think that they are, they have their schedules busy, but they're also on standby because they want to be able to do stuff like this and they want to be available for this kind of stuff. So that's kind of what I was thinking, is that's a really good idea to just, have.
And just for my edification, I apologize, I'm your alien at this table. Is the team that you're talking about and the team that I was talking to Juliet about, are they the same team?
I think they work together. So like, Juliet, are you thinking like Carrie and Kelsey?
Yeah, so like we have there are health department comms folks who sit on the MAC group comms subcommittee, and then like part of our substance use prevention team is on that committee, and there's folks from other departments in the county that are on that same team. So it's a nice roll up of all of the comms folks.
Perfect. Thank you, Rachel.
And they'll work together so well to just make the dreams come true when it comes to like pushing out information and making sure that the right people are hearing about it.
All right, so potentially I should meet with them immediately after this meeting. Yes. Okay, thank you, Rachel. Erin. Is Erin here?
Yeah, I'm here. I was thinking maybe some of the like the faith organizations, churches,
Yes.
and having some, like, just like a general template, maybe we can email out to them, since, you know, they're kind of pillars in the community, and obviously they have a good reach to everyone else in the community.
That is a really good idea. The faith-based arena is something that we really want to make sure that we've connected in. And we will check and find out if the dream team that we're going to be working with, that Rachel and Juliet are telling us about, if they've got something, or if we need to reach out to you guys to see if somebody has a full-on list that we can send out to. Thank you, Erin. Jessica?
So one of the thoughts that was running through my mind is maybe include the resource centers. Like, I know that Carnegie Hall sends out an email each month of like the updates and different stuff that they have going on there. So and we receive that, and I know a bunch of other agencies do. So that way the agencies within the community could get staff to do the training as well.
That is excellent. All right. Thank you for being here, Jessica. That's a really good idea. Jasmine? And I'm just
I think she's just listening because she's driving.
okay. Oh, that's right. Sorry, Jasmine. Thank you for listening. I'm looking in the chat really quick. Recovery Cafe too. Thanks, Erin. David, I'm sure you and Rachel are thinking along the same lines. Anything that you'd like to add there?
The other place that we could potentially put it would be the joint information system, which goes out specifically to PIO networks. So it's kind of more designed for PIOs to be able to inform their community. But I don't see any reason why this can't go out to everybody, since everybody's invited. But I do have specific thoughts. I was going to ask Jessica, how do you get on that email distribution list for the Carnegie Resource Center?
Just as simple as going in there and requesting, and then they write down your email. And
okay,
yep, and then they send it out to you.
Cool. Thank you, Jessica.
I'm going to pause in this rapid fire to ask two things. One is there a way that we can transport people from some of our, you know, further reaching areas like Darrington down to Everett? Like we just brought a car full of people down, or a van full if we had such a thing. That's something that I would like to brainstorm, both for the Darrington and then all the way out the Sky Valley corridor, coming back into Everett for that Train the Trainer particularly event, as well as the Monroe community conversations. It'd be great if we could get transportation that could bring people in and take them back afterwards, all the way out to the end of that road there. Okay, Erin, Britt. I hope I have your name right.
I think it's me, Eric.
Eric, okay.
Morning. I'm over here at the hospital in Monroe. Lots of great ideas. I think the Recovery Cafe was a good idea as well. If it's helpful, I'm sure that the hospital here has a few different social media, you know, kind of presences or platforms. So it could be pushed out that way. I'm sure they'd be willing to do it. And then sort of more local to Monroe. We do have a lot of foot traffic coming through my department, sort of folks coming to various 12-step meetings and things of that nature. So paper or social media could be pushed out relatively locally here in Monroe through the hospital.
Oh, great. Great. That's a great idea. Is it all right if I use you as a contact to figure out who the right contact is if we want to do stuff?
Absolutely.
Great. Thank you so much. Brenna.
I am so sorry. I am in meetings all day, so I am multitasking. I don't know that I have anything else to contribute other than what's already been said.
Okay, thanks, Brenna. Appreciate you being here, even with just a quarter of an ear. Maury.
Yeah, just to echo what everybody else has been saying here. I use social media. We'll probably use our youth coalition to help promote the event with, you know, placing flyers around town, and then use our inclusion group to make sure the flyers and the advertising materials are appropriate and accessible. And yeah, just echoing what everybody, like Joe said, we'll use our coalition and help get the word out and help get people there. And then Lori, to that question of transportation, yes, we could probably arrange something
Oh, that'd be great.
in
That'd be
Darrington.
great.
Yes.
That was a little bit pie in the sky when I put it out there. But I think it's a great idea. Okay, so Mari, what I'm hearing is before we send anything out, you would love to have your folks, you know, look at it with all of the learning that we sent you to do at the Montana Institute, to look at it and make sure that it's accessible.
Exactly. Yes, that would be wonderful.
Okay, thank you. I am stating before everyone here, I will make sure that happens. Gary, any thoughts? Gary may also be having to multitask. How about
I have a
Devin?
feeling.
Oh, sorry, go ahead.
I was just gonna say I have a feeling since he's on his phone that he's probably driving.
Oh, perfect. Devin.
Yes, that's me. Yeah, I was just gonna say I think that we can definitely. I would just if we can get copies of flyers or any sort of other distributive materials, then I'm certainly happy to get those to all the primary care providers. Of course, our clinic in Darrington, but also, you know, our clinics in Smoky Point, Arlington certainly have patients in the rural areas that they can reach out to and other providers and staff. So I think that's a good option. I also was, the other thought I was, which you had already said, but definitely to echo is just transportation. That's certainly an issue for the community of Darrington. And so feeling comfortable that they can get somewhere and get back would be a huge service.
All right.
We can coordinate.
We'll get on that.
I have my hand button on, so I don't have any other comments. Sorry.
Go ahead.
Yeah, I don't have any other comments, but I appreciate being involved and intend to continue.
And we appreciate any suggestions of people that you think could be good candidates to be trained. So if they could go hear an actual event and then come and get trained how to do it. There are some of us that we know are just gonna be good at this. I think the more different places we have little seeds of pollination going on so that we get them all into the train the trainer, the better chance we're going to have at carrying it forward in a dispersed area throughout the county.
Thank you.
Thank you. Jacob.
Hey there, sorry about that. I don't really have too much to contribute. Thanks for including us though.
Jacob, do you have ideas of anybody who might be a good candidate besides yourself to go to the train the trainer?
And then they try to manage it.
Sorry.
Let's see, for the rule stuff, right?
For the community conversations to address stigma.
Yeah. Have we reached out to like maybe like could it be like a fire station personnel or something like that?
Absolutely.
So yeah, like the Gold Bar, like I could connect with the Gold Bar fire chief.
Oh, Jacob, that's awesome. That'd be great. That would be great because we would love to have anybody, EMS or law enforcement wise, I think would be a great intersection of sort of what they do. Yeah, that's a great idea, Jacob.
Okay.
Okay. All right. We are at, let's see, what else did I have in these slides? Oh, yes, this is what we want to do. Wins, needs, and insights. And I'm going to start with Juliet because I think I even forgot to have her make her big announcement at the beginning of this meeting.
That is absolutely fine. I'm glad we dove right in. Yes, the big announcement is that we finally have mostly executed contracts on I believe all of our strategies except our transportation peer contract with Ideal Options, which we have a contract that is going to council. So I think it's on council's schedule and it should be approved within the next week, if not 2 weeks.
Okay.
I was told end of April is maybe a little ambitious, so maybe two weeks from today, I think feels safe, which is the closest we've ever been. So
that's awesome. That's really
Yes.
good news. And
Yes.
and my contract was actually signed, so it's very
Yay.
exciting. We were really
Yes.
hoping it would get signed because there's been some time put in. So yes, great cause. Going out for ice cream after this for sure. And Mari, I wanted you to, David, thank you. Any updates? I heard there was some interesting stuff going on around prevention up in your neck of the woods, and maybe in other necks of the woods.
Laura, did you say me?
I did.
Oh, perfect. Yes, I was like, I thought I heard that. Well, we're really excited. Our youth coalition is starting their peer-to-peer training today. They're actually doing 2 presentations, and it's going to be their kind of first run at it. So the youth coalition is doing their first peer-to-peer training today. So they're a little nervous, a little excited, but we're going to support them all as best we can.
Oh, that's great. Thank you, Tracy. I'm just seeing Tracy putting something in the chat, and I realized just now I didn't ever call on you. It's because I know you're so busy. That would be great to have Darrington School District send out the information for our community conversation through their channels. Let's see, David, I see that your hand is up.
Yeah, and so this is not prevention, but I think it's prevention's a very close brother, recovery. But there's the May 2nd, there's a big recovery event happening at Funko Field in Everett. And so from 12 to 5 is going to be a gigantic resource fair that's designed for folks to be able to come out, and they're going to try and serve as many immediate needs as they can. Mobile showers, getting people ID cards, getting people SUD assessments, getting people set up with, as many services supports they can. And then after the game, after that at 6:30, there's going to be a recovery focused baseball game. And so if people are able or interested to attend, it would be great to have a great showing. If you have people in your area, I know transportation being the big issue here, but if you have people in your area trying to get services, this is a place where they're trying to make as many services available to as many people as possible in one location.
That's awesome. It's a huge event. I can't even imagine the amount of work that's gone into planning it. We're excited to see, well, we're going to be excited to hear how successful it was at our next meeting, especially. Any other updates, wins, stuff that you need, things that you'd like to hear us talk about at future meetings? Because I'm just going to keep talking about community conversations and where the money is. Okay. All right. I know that I want to reach out to Joe. I want to reach out to Gary. Devin, I haven't met you yet. Jacob, you have been on my list from the get-go. I'm going to work on that. Anybody else wants to connect with me? You all have my email. Please reach out, call, send smoke signals, whatever works. Thank you all for being here today, and I will look forward to seeing you. May 23rd is our next meeting. And Jen Rose is going to be presenting, and you are not going to want to miss that. All right. Talk to you all later.
Thanks, Lori.
Thank you. Bye-bye.
Thanks, everyone.
Thank you.
Thanks. Bye.